the reactions I get from my clients with rhinoplasties are the best. You're like, shut up, shut the front door. I can't believe it. I've hated my nose forever and you fixed it in an instant. And my favorite, the same gentleman where I corrected his jawline. I did a rhinoplasty on him, and he had the look of awe and shock. And then he handed the mirror back to me and he just walked out. He's like, well, there's another insecurity you fixed.
Hey everybody, you're now listening to Cup of Queens with Paige and Saray, and we're so excited to have Megan, a registered nurse from Bergstrom Aesthetics, because you guys know how much we love to talk about Botox and all things injections.
Megan is passionate about not only helping her clients look great on the outside, but also feel good on the inside. Megan talks with us about the new services offered like threads, rhinoplasty, and PRP, along with her favorite ways to keep a youthful and glowing complexion.
So grab your cup and enjoy!
Hello.
Hi.
How are you?
I'm good. How are you?
Good. Your space is so pretty.
Thank you. I tried to get the prettiest angle.
Oh, I love
I
it.
love all the white. It looks so like clean.
Yeah.
Yeah, we really like your space.
So fun. Well, we cannot wait to talk with you and just hear all the things. Paige and I just love this industry so much.
We
So
love
anytime we get to
So do
talk
I.
with somebody who has knowledge, we're like, yes, this is like where we thrive. We just want to know everything. So
Yep.
Tell us a little bit about yourself and how you got into this business.
Okay. I'm 38. Married, I don't know what all you want to know. I've been married to 12 years. Met my husband online. It's a really fun story. We have a 5-year-old boy named Oliver. We have a 3.5-year-old girl, Evelyn. We just adopted 2 kittens. I'm in grad school to get my nurse practitioner, and I work full time. So life is a little crazy right now.
Wow. Well, thanks for making time for us. Like, you have a million other balls in the air. That's awesome.
Yeah, exactly. Why not add a couple more? So,
Yeah.
so I've been a nurse since 2011. Got my LPN first, worked for a little bit, went back for my RN and bachelor's, graduated with that in 2014, and I just can't shake the itch to go back for my nurse practitioner. So I'm now back in grad school for that, but currently have my RN and bachelor's. Most of my nursing career has been in internal medicine. I was the nursing supervisor at IMA Healthcare most recently, and I worked very briefly with plastic surgery. Again, that's another long story that I can't talk about here, but worked with plastic surgery, and that's when I fell in love with aesthetics because I knew nothing about aesthetics before that. I would look at med spas and be like, oh, those are for like YouTube, like the really pretty girls who don't need any work done, like look perfect. And, that's not for me, or that's so expensive. I could never afford that. And then working in plastic surgery, I expected those same kind of people to come like, can you fix this one little spot for me? And we had a couple of those, but it was like everyday normal people like me who, wanted their breasts done or a tummy tuck or a scar revision or a rhinoplasty or whatever. It was just normal everyday people, and I saw the impact that made on, like, they just wanted to feel better, and so they got this procedure done, and it changed their life and impacted them in such a big way. So that's where I really fell in love with aesthetics. The surgeon I worked for taught me a lot about facial anatomy, kind of the limits and boundaries of where filler and Botox can help versus where that's not going to help you. You need surgery first, and then we can do the other stuff later, like what the limits are. So I learned tons from him, and then he got my foot in the door. He started teaching me how to do Botox, how to do filler, got me some training, and then I had an opportunity to come here to Bergstrom Aesthetics, where I can do this full time, whereas I wasn't doing it full time there before. I was still rooming patients, and so this is my jam. Like, I really love it here.
Oh,
Love what I do.
fun. That's so cool. I'm so curious. As soon as you said the limits and boundaries, as far as Botox and filler, can you talk to us a little bit about what that looks like if somebody comes in and maybe they just think, oh, I need Botox here, and you're like, actually, that would be an area for filler, or maybe what those misconceptions are per se.
Right. probably the favorite part of my job. Well, I mean, I love actually doing the procedures that I do. I love injecting the Botox and filler, but I love consults because there's so much education that goes into it. Like you said, a lot of people don't know the difference between Botox and filler, or what one does and what the other one doesn't, or threads or whatever. So I love doing a full face assessment on my clients and be like, okay, this is what I see. This is, this is not a checklist of things you need to fix. But here's what I'm trained to see. Here's what we can do to help correct those and soften, lines and transitions and hollows and sagging, and correct some of that for you, push the door back on aging a little bit, and then giving them pricing and everything and showing them what their options are. So some common things that we talk about are like, someone's forehead might get really heavy, like they need a brow lift, they need excess skin removed, but they want me to try and fix that with Botox. Well, Botox is going to make that worse, not better. So we have to talk about that. Sometimes I have to say, no, I can't give you Botox anymore until you get a brow lift done. People don't want surgery, but I don't want to make them unhappy with giving them Botox, making those lines go away, but then their eyebrows are sitting down here because their muscle can't lift it anymore. Or sagging jowls and sagging skin on the neck. I can help that, a couple of millimeters, by putting filler back here or in their cheeks. But there comes a point where to really get the results you want and to make that filler look good, you need to have a facelift or a neck lift, heal, and then come back, and the filler is going to look amazing and you won't need as much of it. So we talk a lot about that.
What about like smile lines? I feel like that is an area that anytime I hear people talk about it, they seem confused, including myself.
Yes. So we call these the smile lines or the nasolabial folds. If you get a fold down here, that's called your marionette line. Both of these are caused by losing elasticity or tautness in our skin. We lose collagen, we lose elastin. So our skin sags, and then we have fat pads all over our face that thin and disintegrate and slide down our face as we get older. So volume loss up here is what, causes this fold. It causes the jowls and the marionette lines. So we have to start at the top where the problem started, putting filler up here, and then you won't need as much filler through here to correct those and soften them. We can do some if they don't want to do their cheeks. If I can't talk them into it, people's biggest fear with aesthetics and Botox and filler is the fear of looking unnatural. And most people who look unnatural with filler are people who are only treating one area and not keeping in balance with the rest of their features. Like their lips get huge, or their cheeks get huge, or they freeze their entire face with Botox and they get fox eyes, but they've lost volume here. You've got to keep everything in balance to keep everything in the same decade to keep things looking youthful.
So beyond filler, just for those smile lines, for example, or even like replacing or replenishing collagen, is there anything that people can use or do in their everyday life that might help that process before doing filler? And I don't know.
No, it's not really a skincare thing. Sometimes getting lasers can help. Lasers can help tighten the skin. So you can start doing that prophylactically to prevent that skin from sagging, but you're still going to lose volume in your fat pads and your muscle as you age. Sometimes things down here can be helped with a little bit of Botox. There's a muscle here that pulls the corner of our mouth down. If I inject and relax that, then they can bring the corner of your mouth back up, but it's mostly volume loss. You've got to do Bellafill or filler threads to help lift and suspend the skin back, things like that.
Yeah.
Not a whole lot you can do preventatively, unfortunately.
So with the fact that preventative is really not a huge option, what is there's probably not a standard, but if we say standard age that you start to see these services be most beneficial and most impactful for people?
30s. The earlier you can start, the better. Yeah. Botox is preventative. I mean, everything I do does have some preventative benefit. Botox prevents the wrinkles in your forehead from getting deeper. If you're holding your skin, putting volume back into your skin with filler or Bellafill, you're kind of cheating gravity a little bit, and it's stimulating some collagen production, which can hold your skin up a little bit longer. So there is some preventative benefits. the longer you wait to start these things, the more you're going to have to spend down the road to correct them. If I could go back, I would start getting Botox in my 20s.
That's what my next question was going to be.
Yeah.
Is there an age? Because I feel like I see it all over TikTok, like 20-year-olds getting Botox who have great skin, but they're like baby Botox, preventative Botox. So is there an age where you're like, hey, actually, maybe don't do it until this time, or is it never really too early?
It's never really too early. Filler, I've seen more of that starting in like 30s is when women really start to lose volume, and some of that's hereditary, some of it's going through stress, illness, things like that can really age you. Some people are just blessed with dark circles under their eyes, sagging skin. I know I've got jowls and a turkey neck coming based on all the women in my family. 20s is a great age to start Botox though, really, because that's when those static lines start to show. And if you can shut down that muscle, then you're preventing those lines from getting any deeper. If you start Botox at 25 and you keep it up for 20 years, at 45, you're going to go back to looking like you did when you were 25. They don't get worse.
That's pretty crazy.
That's when you put it into that perspective.
Yeah.
Because it's impossible for them to get worse when muscle's not creasing your skin anymore.
Huh.
Yeah.
Filler in the 30s is a great time to start, but do it conservatively. Like, you don't need 8 syringes probably for most people. Some do, but just do a little bit here and there, and then pull out the bigger guns when you're older.
Yeah,
you see that volume loss going.
A little bit ago, you mentioned threads. So I don't know if you know, but I don't know what that is. Can you explain that a little bit more? And
threads are so fun. So fun. I think there's only one other injector in town that does them, if I'm correct. So they're kind of new to Fargo. A lot of people don't know what they are. So they're made out of like absorbable suture material. They're actually made out of something called PMMA or PLLA, which is like Sculptra Bellafill. So it turns into collagen. Again, preventing you're treating the problem and preventing it from getting worse while they're in place. Anyway, the ones I use are called InstaLift threads, and they're by single direction cones, like a little traffic cone, but they're like super small. So I insert them in your cheek here. We pull down this way first, and the cones are faced this way. So when I pull back, it's lifting your skin. So it catches on the fatty layer of your skin. Then I pull the other half, cones are faced this way. So we pull way up here, and then it catches and keeps this suspended. So it pulls back and suspends. So it's a really great way to get a little bit of a mini facelift without having to go through surgery. And then it's stimulating collagen while they're in place. So yeah, and they look very natural. You can do cheeks, you can do jawline, you can do fun things like neck and eyebrows, which I'm not trained on yet. I will be next summer, but cheeks and jaw I can do now. And they make a big difference. I've done them on everybody from like 35 up to 65.
So what would be the appeal of like that versus a facelift? Is it just less invasive? Does it have a longer?
Way less invasive. You're here for an hour, maybe,
wow.
and they last 2 years. Yeah, you've got a little bit of downtime afterward. Your skin's gonna look really tight. You're gonna have some puckering. It's other than that, it's pretty painless. We numb you. Yeah, they're super easy, and they're long lasting. So they don't help everybody. If you've got a lot of gels, a lot of sagging skin, they're not going to do much for you.
Sure.
But if you're in the beginning to mid stages of that, it can make a big difference. So people who don't want to go through surgery or want to postpone surgery, I freaking love facelifts. I'm obsessed with them. I post before and afters all the time on my Instagram from surgeons, and there's a place where they're needed. It's a doozy of a procedure. I mean, it's a major surgery, and you're going to wonder, what the hell did I just do after you get it done? Because you're so swollen and disfigured. But after a couple of weeks, you look pretty much back to normal. And then everyone is so glad that they had one done. So there's a place for them. I encourage them. I tell people when they need them. I'm not going to lie to you and say I can fix something that I can't. But you can push it off a little bit.
What is that kind of standard age that you see a facelift being a better option than threads?
Uh, I'd say it depends on the woman and their genetics, but probably after age 60.
Okay,
65, filler and threads probably aren't going to do a whole lot for you until you get a facelift.
sure. Interesting.
Yeah.
And
So
then the threads, and you might still need some threads and filler after that, but they're going to look so much better.
Yeah.
Trying to compensate for, a lot of extra skin.
Mm-hmm.
So that's something new that Bergstrom just started offering recently, then the threads?
Yes. Yep. Within the last 6 months, I'd say.
Oh, cool.
Yep.
Cool.
What
They've
are
been
other
really neat.
new and upcoming trends or different things that you guys are getting trained on or that you have coming into the market?
We just started offering PRP, which I'm really excited about.
Cool.
People who are a little off put by getting something foreign put into their face. They want to do all natural. There's a place where all natural doesn't work, but PRP is a great option for them to like rejuvenate tired, hollow underneath their eyes, lip lines, acne scarring, using literally their own body. So PRP is platelet-rich plasma. So I draw your blood, I spin it in my little centrifuge here, draw out just the plasma that has all your stem cells, your growth factors, your platelets, everything that stimulates healing and collagen production, and I inject it right back in around your eyes, into your skin, around here, acne scarring, whatever you need it for. And that's really cool. So we just started offering that. We have a new peel, a no peel peel from Italy called PRX T33. Traditional chemical peels are painted on your skin. We let it dry and then you peel like a snake for 7 days. A lot of people don't like that downtime. So this one is a higher concentration of the acids, but we rub it really deep into your skin. We let it sit for a few minutes and then we wipe it off. So very minimal to no peeling. That one's been really popular, really great for skin tightening, sun damage, melasma. What else? I've started getting into some niche Botox treatments like Botox for hyperhidrosis, migraines, TMJ, traps. If this gets really tight and is causing headaches, Botox can help that. So fun stuff like learning all the time.
Really cool.
Yeah. It never ends. The stuff that Botox can help with scars. I just started doing that.
What?
If they're like a year or less old, if you have a raised scar that didn't heal very well, you can inject Botox underneath it and it'll stimulate healing. It's kind of a mystery. I don't really know how, but
that's so cool.
Crazy.
It works. It works.
Well, I've also
so
heard
constantly learning.
getting, like their hands or their top of their hands injected too for like sweating, right? Isn't that?
Yep.
Yeah.
Yep. I just did someone. I did her underarms, her hands, and her feet. She had tried everything, and it is something you can sometimes get covered by insurance, but she hadn't been able to. So she came and saw me, and yeah, it made a big difference.
Man.
For people who get like like I've done hyperhidrosis treatment on myself with Botox because I get really nervous when I have new patients, or like right now, typically I'd be sweating because I'm nervous talking. And it's not that I wasn't happy to see them or enjoying the conversation. It's just a nerve thing. I would just sweat profusely, and I don't sweat at all anymore.
That's amazing.
So it's life changing, which is why I offer it, because I like helping people.
That's so cool.
I feel like so many people can relate to like nervous situations, and that is like a different type of sweat. Like it's really not
It's different than sweating when you're hot.
It's 100% different. So that I would have never thought about Botox for that. And then the other thing that like I keep hearing about, and it kind of grosses me out a little bit, but I see such a value, neck Botox. Like what is that about? Because
becoming a big thing.
Yes, and you keep seeing it everywhere. It's like people are saying you take such great care of your face, your skincare routine, but what's your neck and like décolleté routine? I'm like, oh my gosh, I don't literally have
100%, 100%. And we're trying to kind of get that to be the norm here for our clients, because we have clients who have taken great care of their face, And for whatever reason, they've never thought about their neck. And their neck, this looks like they're 60, but this looks like they're 90.
Yeah.
You know what I mean? From sun damage and wrinkles and poor hydration and whatever. So we're trying to make neck, chest, and face the normal for all of our procedures. But yeah, necks are the next big thing. Necks are the big thing. Necks and hands and chest. So there's a lot of fun things we can do to kind of treat the wrinkling and the sagging, the creping skin. We can do diluted Bellafill to stimulate collagen and tighten that skin. We can do lasers. And then Botox can soften those lines as well. Other fun things we can do with Botox for the neck are minor injections. I don't know if you can see, but if you smile really hard.
Yes.
These are called your platysma bands.
Okay.
So your platysma is one thin sheet of muscle from here all the way down to your collarbone. And for whatever reason, no one really knows why, but like your facial expressions, the way you sleep, your posture, it forms these tight bands in part of it. So we can put Botox here to soften those so your neck looks smoother. And then these bands are also pulling on your jawline and blunting it. So if you soften these, then your jawline softens, which is really good. Yeah, so
I've never heard before.
It's literally mine, and it's the best. Like, and you can put Botox all on here too to even further tighten that muscle or relax that muscle and tighten your jawline.
Do you feel
the Nefertiti neck lift?
Do you feel like is it something that you would even notice once you get it? Because I feel like when you get Botox like in your forehead or like that upper region of your face, like you can tell like just like your eyebrows don't lift the same or like you can tell. So what does that do for your jawline? Do you notice it really?
I mean, you're not going to feel any different if you get too much Botox here. If you go too far down, it can kind of affect your ability to, hold your head in a certain position.
Oh yeah.
Never have to do my clients, but you have to pay attention to where you're putting it. But no, it can even help with tension, headaches, tension in the jaw, not having these tight muscles pulling. But yeah, it does make a difference in your jawline, your profile, this area. It can help.
That is so fast.
So you're not going to feel any different, but a subtle but impactful change on your profile and your appearance.
Yeah.
Interesting.
Yeah. It's fun.
The more you know. And honestly, I feel like Botox has just come so far, even over the last couple of years. I mean, like you said, who would have thought that you could do all those different places? Do you have one favorite spot to inject? Or, I mean, even the most common that you see?
For Botox or filler?
Or for both.
Yeah.
I love everything I inject. One thing I've been into, some smaller areas that people don't normally think about have kind of been my favorite lately. Filling temples. Our temples get hollow as we age. So if you put filler or Bellafill in there, I can see yours are starting to get a little bit hollow.
Yes, mine have always been. I'm like, wait, I think that's always been my thing, but
yeah, it could be genetic. But if you fill those, that can really soften the transition from here to here and make everything else look more in balance, more youthful. So filling temples has been really fun. Chins, I've been obsessed with filling chins lately. Chin Botox and chin filler, and jawline. Like I've helped people with just genetically, they were born with like a really strong side and a weak side, and I can balance that out with filler. Did that for a gentleman, totally changed his life. People born with a recessed chin, some people that were born without a chin or a jaw, and they've had surgery, reconstructive surgery as a child that left some asymmetries. We can balance those.
Wow.
A really recessed chin, putting filler here can really balance your profile from the side. And that is huge. Like it looks so natural and it just totally changes their appearance and solves some insecurities. And then another favorite of mine is the liquid rhinoplasty. Those are really fun.
I would love to hear more about the rhinoplasty because that is again something that like I think I've maybe seen the word thrown around, but I truly don't know what it is.
Yep. And it's kind of newer to Fargo. I think there's 2 or 3 other people in Fargo Moorhead that do it. it's so fun. So it doesn't totally replace surgical rhinoplasty. It's not the same thing. But if you don't want to go through surgery, or a pump here is pretty mild, just putting some filler up here can make a huge difference. So I put, my nose is straight, so I can't really show you, but if the hump is here, I put little droplets of filler up here, a little bit here. I can lift the tip with filler. People have a drooped tip. And it takes me like maybe 3 minutes, and it lasts them 1 to 2 years.
Wow.
That's a long
That's
time.
not what I was gonna say, like maybe a couple months.
Yeah.
Oh no, they last a long time because there's the more movement there is in an area, the faster that fillers are going to metabolize. Your nose doesn't move, so that filler settles there and lasts a really long time.
That is wild.
The reactions I get from my clients with rhinoplasties are the best. Shut up, shut the front door. I can't believe it. I've hated my nose forever and you fixed it in an instant. And my favorite, the same gentleman where I corrected his jawline, I did a rhinoplasty on him, and he had the look of awe and shock, and then he handed the mirror back to me and he just walked out and he's like, well, there's another insecurity you fixed.
Oh,
that's so sweet.
awesome.
Oh my gosh, that really is
those are neat. A lot of injectors won't do them because there is a risk of blindness. There's a lot of blood vessels that travel on the sides of our nose that lead to our eyes. If you occlude one of those blood vessels with filler, it can blind you and cause some issues. But I work for a freaking ophthalmologist and he's okay with me doing them. So
that helps.
So I think you're good.
Yeah. Well, and
he calls it a neat trick.
Yeah. And you have, it sounds like, so much experience within just what you were doing previously with understanding the facial construction. And I think I've heard that many of times that your injector is really so important. You can't just go get this and that just wherever and think that you're going to get the same results. It's so, I mean, it's an art in a sense. So
you have to have an eye for it, and you have to know your anatomy. You can't just know one and not know the other.
Yeah. I feel like that's a big misconception. That was a misconception I had when I started just learning about the industry, was that, oh, it's all the same. Like you just can go anywhere. So what are other misconceptions that you frequently hear just within your industry regarding any of the services that you offer?
The number one misconception is that if they get Botox or filler, they're going to look unnatural.
Sure.
It's the biggest thing that hold people back. And when they finally, have watched me on Instagram for months and months and months, and they finally come in for a consult, that's the number one thing they say. It's like, I want to look natural. I don't want Kim Kardashian lips. And I'm like, honey, that's going to take so much work on my part to make you look that way. Like it takes a lot of work to make someone look overfilled and alienish. So that's the number one thing we talk about. Other things are like filler and Botox are super expensive. Okay, and yeah, they are, but for how infrequently you need to get them, it's not that bad. You might need, someone our age might need, 4 or 5 syringes. Okay, that's going to last you once a year, 2 years, and maybe you need 2 syringes a year after that. So it's an initial investment up front, but it lasts you a long time. It's, we think about how much we spend on skincare, how much we spend on makeup, how much we spend on buying new clothes, new shoes, coffee, getting our nails done, getting our lash extensions done. Like all that stuff adds up, but because it's just a small amount frequently, we don't realize how much we're spending on it. You know what I mean? So we talk a lot about price and investment and longevity. Yeah, those are the 2 biggest things.
Yeah.
One, pain. We talked a lot about the fear of pain. It is a needle poke. I can't do what I do without needles. Sorry. But it's not that bad. I have little squeezy things. I've got vibrators you can hold on your chin or your jawline to distract you. We've got ice. We've got music. You can bring a friend with you to hold your hand. I have a lot of clients who are deathly afraid of needles and almost pass out every time I feel their lips, but they keep coming back. So yeah, it's not that bad. The anticipation is worse than the actual needle poke.
Yeah.
And it's worth it. Yeah.
Everybody gets through it. Yeah, it's worth it. It's fun.
Yeah. Well, quickly going back to where you were talking about some of the befores and afters with your clients, I would love to hear if you have a favorite success story, whether it, male or even female, one that really sticks out. And maybe it was the rhinoplasty one you talked about, but if there's another.
He definitely stands out.
Okay.
One of my favorites, though, was a lady who was a little bit older. I think she was in her upper 50s, and she had been through a lot. Like her husband had died, and lots of stress with her kids and moving and stuff. And she came in and she said, I'm happy on the inside, but I look sad on the outside.
Oh.
She had really heavy eyelids. She had a lot of sagging skin, a lot of volume loss. She had sun damage. And she said, I wish the inside and the outside matched. So she came and saw me for a consult. We did filler, we did threads, we did Botox. She saw Dr. Bergstrom, and he did a blepharoplasty, removed that heavy skin on her eyelids. And she's a completely different person now. I mean, now her outside is completely different, and matches who she is on the inside. She's just the sweetest lady you'll ever meet.
Oh,
so that was really fun.
Incredible.
That's really cool.
That gave me chills.
Goosebumps. Yeah. Yeah.
I think it's so relatable too, because we feel young on the inside, and then we look in the mirror and you're like, crap, I've got gray hair, I've got lines, this is starting, like, what the heck? I don't feel like I'm that old.
Yeah.
So we can push the door back a little bit and hope those two things match.
Yeah, I think that's incredible. And I think that, truly whatever you can do, whether it's in aesthetics or any other industry, if it's bringing people confidence, that is, priceless, quite literally. And obviously, being on Cup of Queens, our goal is to bring value to our listeners and to talk with people like you who are inspiring and who have been inspired by other women. So with that being said, what does a queen mean to you?
I love that question. I have people who call me the beauty queen. And, that's fun and it's cute and whatever. It's just a compliment, like, oh, you're the best at what you do. But when I have a thing for queens. Like, I love following the royal family in the United Kingdom. I love crowns. Like, I just have a thing for it. And to me, to be a queen in any area of your life, it means to be your calm in the storm, you're constant, you're steady, you have integrity, you're consistent, you're not reactive. You're just kind of that constant, strong presence for others to follow and look up to.
That was
falling apart in every little thing, and that comes with experience. But to me, that's what it means, and that's what I aspire to be.
Yeah, calm in the storm. I love that, and something we definitely all can practice because it's not always easy. But
and I love that you said don't be reactive.
Yeah,
I'm a very reactive person.
Nice to be. Yep,
but
it's hard. It's hard because the world is chaotic, and it's hard to be calm some days.
Yeah.
Totally.
Yeah. Well, plug away. Tell everybody where they can connect with you guys, how they can learn more, book an appointment, all the great.
Yeah, thank you. You can find most of my work on Instagram at Injector Megan with 2 A's. My mom wanted to be unique, and it worked. Injector Megan, Megaan. That's my handle on Instagram. You can follow us on Bergstrom Aesthetics on Instagram. That shows everything that the spa is doing. So me and our 2 wonderful estheticians, BergstromAesthetics.com, Bergstrom Aesthetics on Facebook. That's kind of where we're at everywhere. So
amazing.
Perfect.
Well, we will link all of it. I'm sure we're going to have tons of people asking for threads and different things and all the crazy stuff that we talked about today. And have a great rest of your night.
Megan.
Thank you. It's so nice to meet you.
You too. Have a great day, ladies.
Bye.